This video represents a typical Prostiva case. We are watching the introduction of the handpiece down the urethra. There are a few bubbles in the way. As we clear the bubbles, you can see the anterior urethra dropping down the urethra to the sphincter. Passing through the sphincter, we see the Verumontanum coming into view, and in the distance we see the interlocking lobes of the prostate. We follow the urethra into the bladder now, a few bubbles again, and you see some of the obstructive tissue, some median lobe and lateral tissue causing obstruction. We're now in the bladder, and I usually make an attempt to identify the ureters to make sure they're well back. This is the right ureteral orifice coming into view, and then we will find the left orifice. I think you can see some mild trabeculation to the bladder, no other issues at this time. I start at the 5 o'clock position at the bladder neck with my first treatment. The antennas are right at the bladder neck. You can see the deployment of the antennas. The video is sped up at this point, but that's treatment number 1. You can see the blanching of the tissue. I usually then place my second treatment right at the vero, so I have my space defined. You don't have to do that. You can go back and forth from side to side, but I think I have less blood loss and better visibility doing one side first and then the other side. There's minimal blood because my assistant does a good job keeping the urethral temperature cooled and irrigating. After about 300 cc's, we'll usually drain the bladder. This is lesion number 3, just about a centimeter forward into the prostate. Here's treatment number 4, and you can now see some of the opening to the prostatic urethra is starting to open up a bit. It's very typical after about 4 or 5 burns to see the sphincter opening, to see the urethra opening up. With a prostate this size, I would probably do somewhere between 10 and 12 treatments. 4 treatments, 4 or 5 on a side, and then some in the median lobe. There's not much median lobe tissue here, but we will go after that here shortly. Now I'm going to go after the median lobe. The position of the median lobe vary. This one's not a particularly large lobe, so I took it straight on. On the second video, we have to sort of attack it from the sides. I always use a shorter antenna length when I'm at the median lobe, usually the 12 or the 14. So here's treatment number 10 right in the median lobe. You can see it just shrink right away. Again, another treatment into the median lobe area. Treatment number 12. I rarely do fewer than 10 treatments, depending on somewhere between 12 and 16 is the average. So that was treatment number 12, and now I'm inspecting the fossa. You can see the nice results. You get a nice straight view into the bladder, minimal obstructive tissue, and the rest of the tissue will of course retract as the body reabsorbs the dead tissue. The whole procedure is done under local anesthesia. Using the block that I have demonstrated before, as over the next few weeks that prostatic urethra will open up even more. This is a very good treatment. Minimal bleeding. 18 or 20 Foley catheter will be inserted for 2 or 3 days and then removed. This video demonstrates Prostiva treatment of an enlarged median lobe. On this ultrasound you can see the median lobe pedunculated into the bladder. This is a straight-on shot of a thumb-sized median lobe. We'll see it here in a minute. Advance the scope from the Veru into the bladder, and you can see the enlarged median lobe coming into view. And that's a typical median lobe that's very treatable with Prostiva. I will usually treat lateral tissue first, and in this case I start again at 5 o'clock and treat right by the bladder neck. Treatment number 1, each treatment again 2 minutes and 20 seconds. For my second treatment I usually pull back near the Veru. In this case, I guess I just treated right next to treatment number 1. There's no particular reason why you need to go back to the Veru, except I like to define my space. With a prostate enlargement with a median lobe, I tend to do fewer treatments in the lateral tissue and more in the medium area. So I think I only put in 3 on the right, 3 on the left. We'll probably go back and put a few more in at the very end. This is treatment number 4. The 7 o'clock position. Treatment number 5. You can see the Veru in the center of the picture there. Treatment number 6. Now moving to the median lobe, I usually use a 12 or 14 on the length for the antenna, and you can see a nice burn right in the top of that median lobe. And then I pull back towards the prostate a bit and get it again. Usually after you put about 4 treatments in, you start to see it shrink down. Sometimes just the position of the scope, cantilevering it down on the prostate, will also help. I did not get to see the orifices on this patient, but we'll look for them later. With a median lobe, they're back enough so that you don't have to worry. Here's treatment number 9 and treatment number 10. I think you can see the lobe retracting already. Again, minimal blood, but a very good job with my assistant keeping the field clear. I usually empty the bladder every time I put about 300 cc's into it, or patients will tell me that they feel like they have to go to the bathroom, and then I'll empty the bladder. Treatment number 12, more at the 7 o'clock position. Getting part of the bladder neck and the median lobe. Again, more in the bladder neck here. Treatment number 13, more at the 5 o'clock position. You can see it helps define the median lobe by getting the lateral tissue out of the way. And then back into the median lobe again. Not much bleeding, but then again, my assistant does a good job irrigating the urethra, keeping the visual field clear. Treatment number 15, again right on the top of the median lobe. As you watch this, you can actually see the tissue shrinking up as you remove the water from the tissue as the antennas heat the tissue. Here's treatment number 16. Prostatic urethra continues to open up. I'm sort of hitting the lobe on the side of it, which helps it, which cuts off the blood supply to the median lobe and again makes it shrink up very quickly. This is the last treatment right on top again. And then we'll inspect the fossa and see how we look, remembering that over the next 3 to 4 weeks the tissue will retract. So you see a nice open prostatic urethra where the median lobe was. On the left you'll see the before, and on the right you'll see the after. Quite a bit of difference. Much less pedunculation. That lobe will continue to retract. We leave a Foley catheter in for 2 or 3 days. This patient will be very happy after this procedure. Thank you.